I want to talk about vaccines. So currently, all vaccines that are currently approved by Health Canada in Canada are perfectly safe. Any vaccine approval in Canada goes through a very strict regulatory and approval processes. And I can say that Canada has one of the highest standard in terms of approving products like in medicine, medications, vaccination, and all these goes through some really high standards of safety protocol. So first of all vaccines are perfectly safe. We have mRNA vaccines, which is Pfizer and Moderna. We have AstraZeneca. We have also Johnson & Johnson vaccine now available. And there are more vaccine coming in the basket of vaccine. There will be more vaccine, at least two more vaccine coming in. There is a lot of fake news and misinformation about the vaccine. I really want to clarify that the Bill Gates and the microchips in it, that the vaccine causes infertility and the vaccine is a trigger to spread the virus. All these are fake news and misinformation, has actually no scientific basis whatsoever. These vaccines there are manufactured by a very high level of unprecedented global alliance of scientific research and scientific evidence. Every little bit of this vaccine manufacturing processes, the ingredients in it, how it works, is a public knowledge. Anybody can go to the World Health Organization, to CDC, to Health Canada, to the Public Health Agency of Canada, and here in Saskatchewan, to the Saskatchewan Health Authority, the Ministry of Health website, Indigenous Services Canada website. All are credible, scientifically proven, verified information. So we really need to be careful that we do not share fake news, misinformation, when you are putting your hand or a finger on the button at the computer, that you don't share those information, because it does impact people's minds and choices and decisions. And in this particular environment that we all want to get out of this pandemic and we want to see a normal life, it's really important that all of us, whether you are a chief, whether you are a health director, whether you're a doctor or a nurse or a frontline worker, or a family man, a husband or a wife or granddad, that we all play our role in terms of influencing and sharing the most correct information with our families, and promote vaccine, because vaccine is eventually the end of this pandemic. And if we have pockets of unvaccinated people, certainly we will not see the end of this pandemic. In terms of side effects, all medications, all vaccines have certain side effects, and we have all along lived with it and happily accepted that. I just want to give you the example of the cancer medication. Anybody on cancer medication, go and ask that individual what they go through. I mean, there is a tremendous side effects, but at the end you look at the overall benefits, that it will cure you, it will get you out of the cancer, you will have a normal, healthy life. And that's why people go through those toxic effects of those medication, but they look at the end of the cancer. So I think if it's the cancer medication, if it's the birth pills, or in this case, let's take COVID, the chances of getting a blood clot or severe complications or death or having a 90-day stay in a ICU is far higher with the COVID than with anything else. So I would really like that people focus on the real facts and the science about these vaccines. We do know that there are rare blood clot associated with the use of AstraZeneca vaccine. But again, the vaccine is approved in Canada. It's safe. So far, all the scenarios or the cases diagnosed internationally or nationally in Canada has been managed very well. Doctors and nurses in the systems are really well prepared how you would screen for those conditions. Anyone can talk to their healthcare provider, and with this, with your own personal choice, and with the suggestions and the advice from your healthcare provider, you can go for whatever vaccine you can get and get it as quickly as you can.
What are some of the differences between AstraZeneca and Pfizer and Moderna?
So in terms of the manufacturing of these vaccines, the messenger RNA vaccine, there is a very specific way of manufacturing that vaccine, in which you use that particular approach which actually stimulates your immune system to make antibodies against those spike protein on the virus. So that is a very unique approach. Have been used in the past, but the manufacturing of this particular vaccine was unprecedented. So that is a very unique approach that has been used for a messenger RNA, very effective vaccine. In terms of comparing messenger RNA with other vaccines, for example, AstraZeneca, in which you use some weak or dead part of the another virus and use that as a trigger or as a stimulus to invoke or to launch an immune response. The overall end outcome of all vaccine is the same, that you want to have an immunity that can fight that virus within your body and doesn't let it spread, doesn't let it progress in a way that you would need to be hospitalized or have severe outcome. So the end product of all vaccine is the same. It's just the way the vaccine trigger the immune system is a little bit different. And all these vaccines, the way they are manufactured, their ingredients are public information. Anybody can read about it. And certainly these vaccines have provided a hope, an opportunity to see the end of this pandemic. So usually the way the vaccines work, so after the first dose, 3 to 4 weeks after the first dose, the immune system kicks in and it works. But I think the real booster in terms of that strong, robust immunity comes after the second dose. So after the second dose, 3 to 2 weeks after the second dose, you have really good protection, like protections from 80 to 90%, or in some cases above 90% protections. That does help in terms of the spread of the virus. That does help significantly in terms of preventing the hospitalization and eventually deaths. So the more we have that higher level of immunity in community, for example, that is the term we use, community immunity or herd immunity, we are going to put a stop to the spread of these VOCs, and we're going to see less and less impact or outcomes on the hospital, in ICU, and in intensive care settings. So the more we have those VOCs addressed by vaccinating the highest number of people, the better it is, and then perhaps we will see the end of this pandemic if we go above 85% in each location for each sort of age group. That will be the end of this pandemic, and also that will be the start of seeing a normal life.